Good morning and welcome to our latest webinar, really focusing on COVID-19 and the preparations really to help you return to your workplace. So we're going to try and provide some advice and focus on many of the questions that were left over from our last webinar. And since we've also got this new guidance come out, hopefully this will be a very informative session. Once again, we are very fortunate to have with us today Dr. Simon Joyston-Beckal, who is the director or one of the directors for Turnstone Law. And as those of you that have listened to us before will realise, not only is he very good on the law aspects, but he's also qualified as a doctor, and so his insight is exceedingly valuable in these times. So really, I think without further ado, we will go on to the session today. If you have any questions as we go, please put them in the question box and we will get those, or hopefully manage to get us through as many of those as we can. And be aware, if you have any technical problems, we are recording this and we will have it available on our website. So you can pop back and see that or pass it on to your colleagues later. So, right, Simon, over to you.
Well, Katharine, thank you for inviting me back, and look forward to answering. We've seen some of the questions that came from last time, and fresh questions can come in this time, and I'll try and take into account some of those points as we go along. But let's start by, I want to give some slides that update on where we were before. Katharine, you're moving my slides. Can we go ahead?
There we go.
I think you've adequately introduced me. Let's move on to the next slide. That link will take people to the last webinar, and I haven't repeated. So the idea is there are slides in that webinar, and then these are additional slides. And these were the points we discussed last time. What are your health and safety criminal law obligations? What do you have to do? Are health and safety criminal laws going to be enforced for COVID? What needs to be considered in your return to work risk assessment? So I'm going to just give a sort of expanding and updating on things that have arisen since then before we go into the questions. But there are some actually very interesting things that have arisen. Let's have the next slide, please. First of all, reporting under RIDDOR, this question has come up from my clients. Should we do RIDDOR reports when someone gets the bug at work? Difficult question. So let's look at what the relevant regulations in RIDDOR say. I'm not going to talk about one which I think is pretty irrelevant for most of you, which is about an escape of the virus if you're working in a laboratory with the virus. We'll leave that one out. That's pretty esoteric. But here are the two important ones you need to consider. Where any person dies as a result of occupational exposure to a biological agent, then you need to do a RIDDOR report. So it's quite clear that the biological agent would include COVID. That's just not in doubt at all. So someone has to die as a result of occupational exposure. Does that mean they caught it in your workplace and that's why they've died? If that's the case, you have to report. And then the other one is where an employer receives a diagnosis of any disease attributed to an occupational exposure to a biological agent. Well, that could be COVID. I've added the bold emphasis. So here there doesn't need to be a death, but you need as an employer to have received a diagnosis of COVID that's been attributed to your workplace. So the HSE website has some information on this, but I think it's a little bit confused and misleading. They focus on what happens in a healthcare setting where it might well be obvious or more obvious that reports need to be made. But they leave unsaid the vast majority of workplaces where you've got a workforce, someone gets the bug, they may well have caught it at work, but did they? And do you need to report? Now, I think there's a very useful guidance from the Office of Rail and Road, which I think they've put their finger on it in this way. This is how they describe it. It needs to be reliably attributed as verified by a registered medical practitioner's statement. These instances are anticipated to be rare, especially as the prevalence of COVID increases in the general population. So really what they have in mind is you get a death certificate or a doctor's note, and the doctor's note says so-and-so was infected with COVID in an occupational setting or at work, or anything that makes it clear that it's at work, because of course otherwise they could have caught it in any other way. I think this gives you a degree of reassurance for most employees that most of the time you don't need to be reporting, or that if you don't report, it's going to be quite difficult for you to be prosecuted. Maybe different if you're a care home or a healthcare or a laboratory, but in most cases, I'm relatively reassured, but equally the HSE are leaving you a bit more in the dark. So, and there is a certain amount of ambiguity here, and every case might be different depending on how much evidence there is, how clear is the evidence that someone caught it at work. Okay, let's go to the next slide. I hope that's clarified rather than confused people. Here's the topic. Could we be prosecuted for people being exposed to COVID? The government guidance, the set of 8 guidances that they published on the 11th of May, are called Working Safely During COVID, and then they have different different specific guidance for different sectors. There's one for factories, one for offices, one for construction and outdoors. There's one about vehicles. There's one about takeaway restaurants. Forgive me if I haven't. Laboratories is one of them. I'm sure I've left one out. Anyway, most of them are, in most ways, they're very similar, and then particularly in the opening pages, and then they give more specific details. But in the opening pages, this is what they say. You should share the results of your risk assessment with your workforce. If possible, you should consider publishing the results on your website, and we would expect all employers with over 50 workers to do so. So this is interesting because it is not the law that you have to share your risk assessments, nor is it the law that you have to put it on your website. So this goes beyond what's in the law under the management regulations, your requirement to do a suitable and sufficient risk assessment, which we discussed last time. But this new bit of guidance encourages you to share it. And it's taking on from where the trades unions have been going. We want more transparency. But beware, there's a little bit of a trick here, because this is going to make it easier for the HSE to check up on you, both if they're doing their own checks, but also if complaints are made, or RIDDOR reports are filed, or complaints are made, perhaps more likely, someone complaining, my employer isn't doing what they should to protect me. And then the HSE can very quickly look at your website and see if you've published your risk assessment. And they can ask you, or they can ask the person who's complained, have they shared with you the risk assessment? So I think you'd be quite brave to ignore this. But then that probably takes you into thinking about 2 types of document. One is your updated risk assessments or COVID type risk assessments, which you're going to share. And the other might be your behind the scenes action plans and discussions about where you're going to get to on some of the decision making. So you may want a lawyer to help you with that distinction. But this gives us a hint of where we're coming to on the HSE's desire, or the government's desire, that you should be teed up in front of the HSE to prosecute you. Let's look at the next slide. And another part of the guidance, which applies to all the sectors, is that they want you to put up a notice. You should display this notice in your workplace to show you've followed the guidance. So the idea is you're going to stick this up, you're going to sign and date it, and it's going to say, yes, we've carried out a COVID risk assessment and shared the results. Yes, we've done cleaning and hand washing and hygiene. Yes, we've taken all reasonable steps to help people work from home. Yes, we've done all reasonable steps to maintain a 2-meter distance. And yes, where people cannot be 2 meters apart, we've done everything practical to manage transmission risk. So it's kind of forcing you to confront the issues. I suppose that's a very good idea, but beware that this is kind of double-edged. On the one hand, of course, it is really a good idea, but on the other hand, it's making it easier to blame you when you haven't done those things, if you're declaring you've done them. Note also, the last two of those ticks, it is envisaged that you won't always separate everyone by 2 meters. So we'll come to that as well. That's an important point. Next slide. So still, could we be prosecuted? I think the HSE are gearing up for COVID prosecution. The HSE are encouraging reporting by workers. The government are encouraging it with their guidance. The HSE, they've allowed the HSE's budget to go up by £14 million. That's quite a big increase, although some will say, yes, not to where it was before the cuts and austerity, but it's still quite an important increase. And the HSE have opened additional phone lines from 30 people on the end of a phone to up to 200 to answer calls, which includes calls from the public, from workers who are complaining. So they are gearing up to come down heavy, as requested by the trade unions, on people who don't, employers who don't do what they should. Let's look at the next slide. But can they prosecute for workplace exposures of COVID? There's an argument that you might muster that maybe they can't in most cases. If you look at something which most people wouldn't look at very often, Section 1 of the Health and Safety at Work Act, it says, for the purposes of this part, that's most of the Health and Safety at Work Act we deal with, risks arising out of or in connection with the activities of persons at work shall be treated as including risks attributable to the manner of conducting an undertaking, the plant or substances used for the purposes of an undertaking in the condition of premises. So I've added the emphasis in bold. So what health and safety at work is about is risks attributable to the manner of conducting your undertaking. You bring someone into work, they're going to be swinging a hammer, they do it in an unsafe way, that's what this is about. You bring someone to work in a laboratory, they're going to be working on dangerous viruses, you don't have adequate fume cupboard or something, they're exposed to the virus, this is what it's about. But does it include public health risks that are attributable to the spread of a community-acquired virus amongst the non-healthcare and laboratory workforce? I'm not sure about that. And there is certainly a good argument that says public health risks are not what health and safety laws are about. The health and safety laws are workplace laws. They're about risks created by you. They're not really about whether you've gone the extra mile to do public health measures to reduce a community spread of a virus. Well, it's an argument. If that argument were to succeed, it leaves open to challenge some very wide points. Does the Health and Safety Work Act apply at all to the sorts of risks we're worried about outside the healthcare and laboratory setting? And all the other subordinate regulations about even about risk assessing or about certainly about protective equipment. And furthermore, do the HSE and the environmental health officers have the powers of enforcement? Because their powers come from that part of the Health and Safety at Work Act. So if the Act doesn't apply, they don't have the power to tell you off They don't have the power to send you a fee for intervention notice, an improvement or prohibition notice, or to prosecute you. So I think this is a very strong legal argument. However, in all the circumstances, if you get prosecuted, are the jury going to agree? Not necessarily. Is the judge going to agree? Not necessarily. If you're in a battle with the HSE over a notice, an improvement or prohibition notice, will the employment tribunal agree? Well, maybe. Maybe that's a good forum for an argument like this. So let's, my slides have just gone for a second. Let's go to the next slide, please. So what are the difficult decisions that you could be facing? Here are some of them. I'm not going to answer them all, but can we keep operating if we're struggling with social distancing? I'm going to talk about that. The answer is affect risk assessment and taking account of guidance. How far can we balance commercial losses against accepting the shortfall from ideal health and safety protection? Again, it's a question of risk assessment, but watch out. Let's assume for now that my clever trick to get you out may not work. Let's assume Health and Safety at Work Act does apply to all this. It's very difficult to argue that we shouldn't have spent extra money. And that's really linked to the next question. Should we pay for an additional protective measure? You can bring into play commercial arguments, but you will have to convince the jury that it wasn't reasonably practicable to have spent the extra. That's going to be a tough test after the event when perhaps someone's been infected or many people been infected. Maybe people have died from in your workplace or arising from. Can we tell staff to return to their commute, if their commute is crowded? I think that's a tricky one. I think key word here is, can we tell staff to return? I think it's about once you start ordering them to return or pressurizing them to return, then you start putting yourself in a vulnerable position, I think. Can we make staff share work vehicles? Again, yes, there are circumstances where staff can share work vehicles, and I've got some, we'll talk about that. Can we make them do it? I think we need to be aware that our risk assessments should take into account the views of staff. We should consult, take into account trade unions or employee representatives and individual pressure points. So a staff member who says, I'm particularly vulnerable, I've got a lung condition or something, I really don't want to be in one of the shared vehicles, even though you've done all the normal protective things to space people out in the vehicle. I think you should be very wary about making staff return in those situations. Next slide. So, social distancing, how far do we have to go? That's the nub of the question for everyone at the moment. There was some fairly good guidance in April from Public Health England, where it's not possible to remain 2 meters apart. Staff should work side by side or facing away from each other rather than face to face if possible. And interestingly, of course, that suggests that the 2 meters is not sacrosanct. And then the next point, where face-to-face contact is essential, this should be kept to 15 minutes or less wherever possible. Again, that's you may find it difficult to say that your operation is essential, or that the part that is putting people face-to-face is essential. This is all part of the risk assessment, but it just goes to show that you can take into account time and and necessity. Let's look at the next slide. And we've got more coming out in the more recent guidance, the 11th of May guidance. Sorry, I'm mistaken. This is a separate point, which is very interesting. This was the Health and Safety Executive's comments at the Work and Pensions Select Committee. It was on the same day as that guidance came out. Here's a quote from the Chief Executive of the HSE. It isn't as if there's some sort of bright shield of 2 meters that's around everybody. And if ever that's been breached, then you're unsafe. And as long as it's in place, then you're definitely safe. That's very interesting. I wish she'd have put that on the HSE's website. Well, I'm putting it on this slide for you. I think it's tremendously helpful as a reality check. Let's look at the next slide from the same select committee meeting. This was the Chief Scientific Advisor and Director of Research at the HSE. And this is what he said. The 2 meter rule is not sort of like an immediate, once you go below 2 meters, that's it. It's a very dangerous situation. It's a function of both distance and duration. So yes, the risk will increase if you get closer to someone. But if you're close to somebody for a short period of time, then you can manage that risk. Similarly, the orientation between people is quite important. So there's a big difference between 2 people facing each other and 2 people with their backs to each other. This is tremendously important. And I think I'm very glad they've expressed it this way, because one of the things that's bugged me about the whole treatment of the public debate on this virus is this sense of absolutism. There must be a specific way to do it. We want specific rules. And as long as we can follow the rules, then that's okay. Why won't they tell us the rules? And epidemiology and virology doesn't work like that. I know the health and safety world loves to work like that, with a kind of shut off what decibel level is okay for noise at work. But those are this is a continuum, and of course, it's a new and evolving field. So it's very welcome to have these comments and to show that it's not just 2 meters; it's duration and distance. And I use the word direction. Which way are you facing? Very welcome. Let's look at the next slide. I hope you find that helpful. The government guidance, this is in all of those specific guidances from the 11th of May. They say work through steps in order, and there's a number of steps, won't be surprising. And I've just got some extracts. But when they use work through the steps in order, it's really important. We're familiar with that in health and safety. The order with which you approach your preventive measures is important, your hierarchy of controls. So they say this is in the document, where the social distancing guidelines cannot be followed in full in relation to a particular activity, businesses should consider whether that activity needs to continue for the business to operate. And if so, take all the mitigating actions possible to reduce the risk of transmission between their staff. So in other words, you need to consider whether you need to do that activity, but maybe you do need to do it. And if you do need to do it, then you've got to take the mitigating actions that are possible. So they are giving you some opt-outs here. Then later on it says, if people must work face-to-face for a sustained period with more than a small group of fixed partners, that's because one of the mitigation measures is you have a little group together, say 3 police officers who are going to be doing their shifts together. They're going to be in a van together, or they're going to be working closely. And then there's a bit less risk because you have that cohorting, as it's called. So if people must work face-to-face for a sustained period without cohorting, I guess that means, then you will need to assess whether the activity can safely go ahead. So, in other words, you will need to assess, you must risk assess, but you may conclude that it is safe, taking into account some of the other points, perhaps in the earlier slide, for 15 minutes. And then there's an important point. No one is obliged to work in an unsafe work environment. Okay, so you really shouldn't be pressuring and forcing people to work in an unsafe work environment. Of course, if you're pretty confident it is safe, then maybe that opens the door to you being a little bit more, pressuring them a bit more. But that's a tough decision, tough decisions for you to risk assess. Next slide. So risk assessment is a balancing exercise. You need to consider the latest guidelines. You may not just look at the UK. You may find useful guidance abroad, useful guidance from the World Health Organization, useful guidance on masks, which frankly differs from some of the UK stuff on face masks, if that supports a direction you want to go in. Why not? And if you're in Northern Ireland, Scotland, Wales, you should be receiving some local guidance as well as looking at the English guidance, taking into account those localities. Alternative means of operating, small fixed teams, duration and direction of exposure, PPE or other barriers, face masks will come to in some of the questions. Feedback from consulting employees and or their representatives. That's so important. And we were talking a bit last time about questionnaires or how we're going to gauge what our employees want us to do, and we may come to that in the questions. Results of testing when available, that's going to become more and more important. It's tremendously important. It's limited at the moment. But of course, that will play into the picture. And necessity. Let's look at the next slide. So what am I saying? I think it's pretty clear you can balance the 2-meter separation against other mitigation measures, and you should balance it against other mitigation measures. And these include the duration, direction of proximity, barriers, hand washing, fixed teams, cohorting, and PPE, face masks. That is part of the picture. You must also take into account necessity. That's a weak necessity factor is what's necessary for your organization. Can we survive? Can we do our job? Can we survive? That necessity argument. But the stronger necessity argument will be it's necessary for society and the public interest because we are the fire brigade, ambulance service, an essential service. And there are wider essential services, and maybe one of those essential workers. Face masks. They're not currently recommended by the UK government for COVID outside of clinical care settings. But it's difficult to view that advice other than without thinking that's a kind of because they haven't got enough face masks and they're worried about the NHS and healthcare not getting the face masks. And so they're infecting their advice on face masks with their concerns about whether there's availability and resources in those prioritized areas. So it is a bit problematic, and you see that the advice is different in other countries. But it rather means you can go either way on face masks. If you take a view that you don't want to go for face masks, you can bring in the government's wishy-washiness to your risk assessment. And you can say, look, there are doubts about the benefits of face masks. So in our risk assessment, we focused on other things. So it can be used by you as a kind of excuse, if you like. Difficult for you to be blamed for not using them. But frankly, I think it's equally easy to justify face masks as being a useful part of a range of measures. And I would, if I could, want to source supplies for my workers if I thought they would be helpful. I think they may well be helpful if you've got people close. And I think they're useful mitigation and reassurance. But when I say useful mitigation, I really do mean that. I think I'm fed up with people saying that because it's not 100%, there's no point using face masks. Well, if it's 20% effective or 30% effective, if it's effective in a shop and effective in public transport, then why is it suddenly not effective to be worthwhile in most workplaces? I don't get that. I don't think it's logically coherent. I think there are going to be changes on this. But as I say, you can kind of use it both ways, and it's clearly going to be a moving thing, and it's a difficult decision. Let's move on. Social distancing, how far do we have to go? What about vehicles? So there's a specific government guidance on working safely in vehicles. It says vehicles should not be shared if possible, so that's your hierarchy. Try not to share them. If it's not possible to keep a 2-meter distance in a vehicle, consider additional safety measures. Steps that will usually be needed, they say, and then they give examples with physical screening, so some kind of perspex barrier, plexiglass, whatever it is, sitting side by side, opening windows, fixed pairing, cohorting, regular cleaning. And they've got some nice pictures to show how you might do your cleaning. So that gives you a good indication of where the government are coming from. And the indications generally about the 2-meter rule. Let's look at the next slide. And then this is from their guidance on construction and other outdoor work. And they've got a picture of a sort of minibus, and the X's are where you're not supposed to have people sitting. So you can see they're trying to spread people around the minibus. But they're not, you know, seats 6 and 9 are closer than 2 meters, aren't they? So they're breaking the 2-meter rule. But you think about other measures. Are we opening windows? Are we cohorting? All the rest of it. How long is the journey? Is this a journey under 15 minutes? We might be more relaxed. If it's a journey that's a 3-hour journey to get to a work site, you might be more concerned, and you'd want to put in place, you'd want to really think about extra measures. That's my view. That's not what they say. But anyway, you need to risk assess. I hope that diagram helps to a degree. Interestingly, the front row, of course, interesting that the seat on the passenger side, away from the driver, is got an X. But then, of course, that arrangement is the typical transit van arrangement of so many of our workers. It's interesting. If I'd have been in their seat, I'd have probably released that X. In the government's place. I think that opens a few points up for wider discussion. Next slide. Well, here are some pictures of what you might do in your lift. Again, I don't think the different distances are 2 meters in these pictures. They're probably not. So it shows that, okay, for a 1-minute lift journey, you don't have to be doing 2 meters, but you do have to do something. Also, look at which way those feet are pointing. They've taken into account it's not just how far people are away, it's their orientation, the direction in which they're facing. So they've got all these people facing the edges, facing the wall of the lift. If you're going to do that, that's interesting. You've also got to think about if you're just at the moment putting in place extra cleaning for the lift buttons, you might want to make sure you're doing extra cleaning for the places people are smearing their faces on the edge of the lift by following this guidance. Next slide. This is from the government's guidance for the office. So you're going to paint little orange zones around people's desks and workstations. Interesting idea. Anyway, that's the official guidance. So helpful. Next slide. This is in a factory, and you can see they've got in the middle picture some wooden dividers. Next slide. And this is from the guidance on laboratories, but it applies to others as well. In your reception, yeah, I guess that's right. You've got a 2-seater sofa. It invites 2 people to sit down, doesn't it? So in a rather horrible way, let's cover it with tape. Next slide. And this was from the construction guidance. But even if you're an office-based company, if your facilities allow, you might have an outdoor space. You want to hold a meeting, better to hold it outdoors. Next slide. Quick point on statutory inspections. What if we're running behind? So the statutory inspections are for lifting operations, LOLA, and pressure systems. Consider also, I think there's something to learn here about the other things that need periodic inspections, Legionella, fire risk assessments and checks, and gas checks. Next slide. The agency have given some guidance on this. They've said you should get, and they haven't said don't worry. What they've said is you should get your statutory inspections done, but the inspector should do it complying with distancing. And even if the workplace is otherwise closed, you should still try and get the inspector in to do the inspections. They say in their guidance, and there's a link to it, only use equipment, so that might be a lift or lifting equipment, pressure vessels, beyond its inspection date if it's critical for essential work and it's been risk assessed as safe. Not quite sure how you do that unless you're if you're you might be able to do it, but if you were capable of doing it properly, you'd probably be the competent person who could do the thorough inspection. But anyway, risk assess it as safe. Maybe you'll pick up the phone and speak to the company, and they'll say, the inspection company, we can't get anyone to you for 2 weeks. And you'll say, well, look, it's a brand new lift. It's passed its 6-month inspection by 2 weeks. Do you think it's going to be safe, given that nothing's really happened in the last, and maybe they'll give you the reassurance. And it says here, you can demonstrate all reasonable attempts to get it tested. So you've cajoled and pushed the company to do the testing more quickly. They haven't managed it. You've looked elsewhere for other testing companies. You just can't get anyone in. Quite difficult to satisfy all three of those. And if you can't, then the HSE say, don't use the equipment. Consult with the insurers. Note that there's a condition of your insurance probably that says this equipment must be tested within its time limits. So you ought to let them know if you're planning to use it beyond the date. Don't furlough your whole facilities team. Yeah, this is just a point from me, really. I think one or two employers have got the idea, let's just mothball the office, mothball the workplace. I don't see why your facilities people shouldn't be coming in, socially distancing, and doing all their normal checks on fire tests and gas and all the rest of it, so that when you do decide to bring people back, the office is safe. This is a note just to MOT. Although the HSE haven't given any forbearance, in terms of MOTs, if you've expired, you get an extension of 6 months if it was due on or after the 30th of March, but you still must keep your vehicle safe to drive. Next slide. Right. Finally, let's come to some of the questions.
Right, thank you, Simon. What I've done is I've grouped our questions from before. And so we're going to start with the questions on DSE, so display screen equipment. Mainly the questions have come in about people working at home. And they're asking, what about the current regulations and what do we really need to do? If you may, I'm just going to sort of talk to you, make the same reference to the to what Sarah Alban of the Health and Safety Executive was talking about recently. And just to quote, to say that employers have to provide office equipment to staff who are working from home for a protracted period to prevent them developing injuries. And that very much fits in, I think, with what we've said before, is now people are not really working at home temporarily. Employers need to cast a light to think, are they supporting people properly at home? Do you want to comment on that at all, Simon?
Yeah, I think temporarily has finished. I think the HSE, surprisingly, were quite forgiving or potentially misleading in what they've said. Because I don't know about you, Katharine, you know more about it than me, but I think 2 or 3 weeks hunched over a laptop on a sofa is quite sufficient to give you a rather nasty musculoskeletal spasm and several days, if not weeks, of pain. And if anything, one should, once you've got to a few weeks, you're at that level, in my view, with musculoskeletal disorders. And that is what the DSE stuff is all about, musculoskeletal disorders. What do you think, Katharine, as a physio?
Absolutely, I agree with you. And in fact, from my point of view, doing assessments and still doing them remotely, we've started to see an increase in people not coping and back problems and neck problems and things. So we're beginning to see it come through, I fear. I think that's fairly straightforward. Let's move on to PPE and masks, because there's been a lot of questions about that. And I think we've also had some more guidance. There's a fear that masks are and PPE at the bottom of the control hierarchy, and that people should not rely on them as the first thing. And then also, what systems should people be putting in place to make sure the PPE is appropriate And do masks actually come under PPE at all?
Well, we've been asked that question. I looked up the PPE regulations 2002, and the definition of PPE is something that's designed to be worn by an individual for protection against one or more health and safety hazards. So I think even a common surgical mask is designed for protection. It's not designed for 100% protection, but it is designed for protection against spread of droplet viruses. So when you go to the dentist in normal times wears a mask, a normal surgical mask. Why? Well, I suppose maybe to protect you from whiffing his or her bad breath. But no, I think it's a two-way protection against the idea of common viral infections and sore throats and all that sort of thing. So it is there as a safety measure, even though it's not a 100% measure. It's a partial protection. So it seems to me that face masks, surgical masks, face masks are likely to be caught as PPE in most cases. And someone said in one of the questions, well, we were told that these masks were just for people's reassurance, even though they wouldn't be effective. Does that mean it's not PPE? Does that mean it doesn't have to comply? Well, I think it still is PPE. I think that's what it is.
Yes, I think I would agree. And I think we would just add, we've had a few other questions. And I think many of the questions about disposal and what advice you need to give people on PPE have been very well answered within the government guidance documents. And I think anybody who does have masks and PPE should have the guidance about putting them on and disposal. And as I say, I would refer people to the government guidance on that.
And then there's the issue of whether you provide the masks or whether your people provide the masks. On balance, if you think it's worth doing, then you should be the one providing it. I don't like the idea that you think it's worth doing and then you tell your employees they should do it and get them. If you merely say masks are permitted, we're quite happy for people to wear masks. So you have a socially distanced workplace where you've got other measures and you consider that masks aren't necessary. Nonetheless, you might permit staff to wear masks if they wish. That's not the same as saying they should wear them. But you need to be pretty clear which of it you're doing. If you're permitting it, then you can let them bring their own in. If you're requiring it, I think you should provide it. But we do have a difficult situation where people are commuting on crowded transport, told by the government to wear masks on the crowded transport. Then suddenly they arrive at work. They may or may not be just as crowded or nearly as crowded or whatever. And then the employer is saying, oh, but now it's okay because I followed the government's risk assessment and you don't need to wear masks. Well, I've made my comments about that. I don't think it's very satisfactory in the long term.
In fact, Simon, that brings us very nicely on to my next topic, which is commuting. The commute to work is usually considered to be the responsibility of the business. Is it necessary to include it in the risk assessment and provide control measures?
Yes, I think in normal circumstances, that's absolutely right. Commuting is not part of health and safety law. I think in the current circumstances, to do an adequate risk assessment, you need to take into account commuting, in my view. I don't think you could ignore it if you're giving a holistic approach to caring about your workers in the workplace and at work. You still need to consider how they're going to get there, in my view. And I suppose you could say if you don't need to do it for for the worker themselves, you need to do it for their colleagues. So it's relevant for the colleagues, for you to think about how other people are going to be commuting. So I don't think you can ignore it. I mean, if we take that really strict view that I said earlier, of course we could ignore it because we're not going to be prosecuted about it. But I don't think most of my clients are not going to take that strict view. Unless, of course, we do get prosecuted, then I will be the first to jump up and shout that the strict view is the right view, or if we receive a notice or a fee for intervention.
If it's of any value to people, in the interaction with my clients, most of my clients are considering people's commute when considering who to return to work. And they're taking what I would call a sensible approach. Right, next question. What advice is there for when our organisation also has an element of interaction with the public? Delivering a service, but also public employees being safe. So, I think the question is, what sort of risk assessment do they need to do considering both employees and clients and public?
Yes. Well, I mean, the easy answer is Section 2 is your duty to staff. Section 3 is your duty to other people, and that includes members of the public. You need to risk assess. You need to care just as much about those public in the interaction. I don't think there's any surprises there. Hopefully, some people who interact with the public are doing it in people's homes. And there is one of the guidances from the 11th of May from the government is about you're going into people's homes, what do you need to do? And I think that's tremendously helpful. I hope that helps. Give some reassurance that you can go into people's homes as long as you think about risk assessing how you're going to do it.
Yeah, I agree. Right, we're going on to some of the legal issues. Many of these you've covered, so I'm going to try and pick out the ones perhaps you haven't covered quite so much. If an employee prefers not to return to work and they're on furlough, what are the options if the employee is saying, no, I don't want to come back, I want to stay on furlough? Any thoughts on that?
Yes, I think, well, this is one where it's going to be easy for you and me to say what to do and so much harder in practice. So this picks up on what we were discussing last time about some kind of consultation, questionnaire, finding out about your workers and what their views are and their issues are. And in this case, you've got an employee who doesn't want to return to work. Well, why? And it may be they don't want to return to work because they're frightened of the commute, or because they're frightened of the work, or because they've got a vulnerability in their respiratory system, or they've got an elderly person living in their household. So there can be all sorts of reasons. And somehow we need to be receptive of those reasons, to take them into account in our risk assessment. And I think we need a return to work plan that prioritizes, whether it's a points-based system that helps you decide who to bring back in what order. And the people who really don't want to come back are the ones who are at the back of the queue. But it's easier for us to say than to actually do, because it may be that it's the person you really want to come back because they do a useful job for you is the one who's saying, I don't want to come back. And all the others are people you don't want as much. So it's very tough. Very tough, but I think you need a rational, organized system that is receptive to the individuals and the differences in them and the tasks they're going to do at work, that takes into account all these things as much as you can to decide who's coming back to work.
I agree. A very simple one. What kind of enforcement can we make? Can we literally ask a worker to leave because they refuse to wear a mask or comply with our rules?
I think there's an easy answer to that. We should be familiar with firm safety rules on a building site. Someone's not wearing their protective equipment, their hard hat. They're told to put it on. They refuse to put it on. They're told, get off the site. We don't want you back on site. or we don't want you back at work until you agree. So I don't see why that would be different to someone who refuses to comply with clearly set out rules that you have decided upon following a risk assessment for how you're going to deal with COVID protection in the workplace. It could be someone continually refuses to maintain distances or orientations or whatever it is, which way they're pointing, and you continue getting in the lift when it's 3-4 people in it or whatever it is. Any of those things. You'd start with a warning. You start with clarity of rules, then you have a warning, and then you follow up with action, I guess.
Mm-hmm. Mm-hmm. This is, I think, is a good one for you. Can the UK government expect a raft of criminal actions due to failings to provide adequate PPE for frontline healthcare staff?
Well, a slightly cheeky question. Of course, the government probably not. It would be the healthcare trusts, I think, is what they're getting at here. So, because of the nurses and healthcare workers who've been exposed, who haven't been given adequate PPE, are the trusts going to be prosecuted? Maybe. Now, if they are, they've got one point in their favour, which is the necessity argument. We did what we could, but we weren't going to not treat patients, and we weren't going to send our nurses home and leave the wards empty when there were patients in the wards, just because we couldn't get enough masks on Tuesday. So they do have that argument at their disposal, but overall, I think they're quite vulnerable. And I suppose I'd be quite annoyed if I'm defending a typical commercial company which maybe is in trouble for an office-based COVID infection and is being prosecuted for that. I'd be quite miffed if we were being prosecuted, and yet an NHS trust, which might have been responsible for a dozen cases of people dying due to inadequate PPE provision, doesn't get prosecuted. And it's up to the HSE, I guess, to balance and prioritise. So we wait and see. I think there may well be some stern letters and rebukes to some NHS trusts coming from the HSE. I think they ought to be thinking of that. And we really, really mustn't underplay the significance of this. I mean, maybe I'm going to be a bit political now, but we have a situation where, in many ways, there's been a complete failure of planning in the gathering of PPE for our healthcare workers. There's no great surprise. They've had years they've known. They've had lots of advice that they needed more supplies. There ought to be some comeback. Anyway, there we are.
There we go.
End of political.
Another risk assessment question. Many people who are COVID positive are apparently asymptomatic. Does this mean for the immediate future we should treat everybody as if they're positive, and when we're looking at our risk assessments and control measures?
Well, yes, I think we do, don't we? We treat everyone as a potential positive. That's why we ask people to wear masks, and we wear masks ourselves, that's why we distance. Why else are we distancing? We're treating everyone as potentially positive. Yes, of course we are.
I think that's the basis of the risk assessment, really, isn't it? And while we're talking about positive tests, there's a question here about testing. If somebody has a test, are we able to ask for evidence of the results as opposed to just taking their word for it?
Well, I don't quite know what you're going to do with the evidence of the test. I suppose if it's that earlier question about the RIDDOR reporting, then the answer might be yes. So if you want evidence that there's a doctor's diagnosis that they caught it at work, but generally I think you need to be careful. It's a two-way thing. Be careful what you wish for. When we were talking a minute ago about questionnaires or finding out about your workers, you need to be very careful what you're asking for. You want a certain amount of information, but not too much. So I think we talked about this last time, which is You don't necessarily need to know that the reason a particular employee is in a particular vulnerable group is because they've got a particular cancer that they're being treated for with chemotherapy. They may or may not have told you that, but you just need to know that that particular person has one of the following 5 reasons why they might be a vulnerable group, or 10 reasons, or whatever the list is. So in other words, because the trouble is, the more you collect in terms of information, the more you then worry about what if you disseminated it inadvertently and breach confidences. So be careful about asking for too much.
Okay, this is an interesting one. As a part of the return to work process, we are being asked to take temperatures of everyone entering the building. No risk assessment has been told if parties should wear a mask or not. The people who will be taking the temperatures are not medically trained. Do we know do we've got any advice about classification of masks, or any what sort of PPE the people who are taking the temperatures should be wearing, or should they have a physical screen? They're just looking for some advice, this person.
I think it's very difficult. I think although there may be a superficial attraction, say you're a normal office, maybe you're a fancy office building, and you do everything in a fabulous way, the money's not really an object, and the landlord thinks it's a good idea, let's put someone at the front gate who's going to be there with one of those fancy thermometers and take people's temperature as they go in, to show how much we really care. But once you start thinking about it, as this person, this questioner has, it starts to be really fraught. You know, what do you do, and what PPE do they wear? What do you do when people have got a temperature and they're not your employee, they're someone else's employee? You're going to say you're not allowed in the building, and where does it take you? I think for most workplaces at present, it's not part of the guidelines as far as I see to have it. I think at present, temperature taking is maybe a step too far, and it's going to be fraught with all sorts of issues. But if we are running a care home, maybe a very different issue. Do all our workers or any visitor to the care home come through a particular entrance where they get a temperature check done? Very different, very different. And maybe the care home has better facilities for putting the person who's taking the temperature into some better PPE.
Yes, I think it very much comes down to, I think a lot of people's risk assessments are going to be very different, because they've got, different risks, different opportunities, and that type of thing.
Actually, can I add this? Sorry, I'm going to jump in because this links to some other questions I've seen very quickly. It's also about shared responsibility with other people who you share a workplace with, whether you're a tenanted building and you've got other people, or you've got landlords, or you've got contractors visiting your building, or in all these cases, you've got multiple employers, and it's beholden upon you, I think, to liaise as constructively as you can in this difficult time and work together on each other's risk assessments. And, for example, try to balance the risk assessments the way you want. Some of the questions are about fire evacuation drills. What happens if we're all in the fire escape together and we're all crowded on the staircase? These sorts of questions. Well, that's the stuff you need to liaise with your neighbors in the building and your landlord and think about planning for that. I hope that helps. There are quite a lot of questions on that area. It's just about coordinating with other employers insofar as reasonably practicable, I think.
Yeah. I've sort of taken, I suppose, the main ones we didn't cover. Chris, have we got any new questions that are different from the ones we've covered, or what Simon has covered today?
Oh, Katharine, yeah. I think a lot of the questions that come through have followed similar themes, and I think during the presentation A lot of the questions were answered in one form or another. There's a couple that I've picked out that perhaps worth spending a little bit of time on. One being, the question is, I have a question related to the guidance issued on the 11th of May, which asks that paper towels be used instead of hand dryers. What's the rationale behind this, and is it actually a legal obligation or not?
Right,
Katharine,
well,
have you seen anything written about this? I'll be guessing. Have you actually seen anyone commenting on this?
I have seen it written, and I have to actually say we made a decision to go to paper towels when we come back to work. I think hand dryers is all about movement of air, particularly if you're going to have a shared bathroom area with hand dryers. It may be inappropriate. And it may be better to have paper towels that are then disposed of in a lidded bin. I would say it probably is a case-by-case basis, though, and I think it also depends on how much air movement your hand dryer does actually produce.
Yeah,
I mean,
I guess so. You might also think about some of those dryers have a little flippy thing, so you can choose to point it upwards at your face. You might want to tape it so that it can only point downwards if that's the case. Or if you've got one of those, you might be even more keen to put paper towels. The other advantage of paper towels is that they physically remove an extra layer of contaminant that you haven't washed off, but that doesn't happen with the hand dryers. On the other hand, I don't want to over imagine that hot air is going to dry out the beastie, so it may not be such a dreadful thing. Anyway, there we are. Next, any other questions?
I know certainly from my own very, very anecdotal experience, my wife's told me for a number of years not to use the hand dryers and use paper towels instead. I think that's just general knowledge infection control, isn't it? But as I say, purely anecdotally. Okay, moving on. So in regards to face-to-face and the duration of 15 minutes that's been advised, if a screen is put in place, does this allow for longer periods of communication? And is the 15 minutes still recommended as a maximum period?
I think.
So I agree that I'm going to say that everything to be risk assessed, but it all depends on the screen. If the screen's really good, you could sit there for 8 hours, do a full 8-hour day working next to someone. You could be right next to them with a screen between you. So it all depends on the circumstance.
Okay, good. Thank you, Simon. Okay, the guidance is suggesting that hot desks should be avoided. However, I cannot see another way of reducing the capacity of a large office, say 300 people, to enable social distancing. So I'm considering that we provide appropriate cleaning materials for each workstation and a checklist. Don't think this is part of the government guidance. However, in large offices, this may be helpful. With this mitigation, am I right in saying or evidencing that this would be sufficient?
Oh, I think that's difficult to say whether something be sufficient. I think it's certainly good to put those controls in place. I'd have those controls in place anyway. I think if one could actually allocate desks to a group of people rather than have pure hot desking, that would be better. And certainly we need to think about, the tracking and tracing element that I think is going to be come into play. So I think just having desks that can be randomly used by anybody, I think has problems full stop, but also has problems as far as the tracing is concerned. So I difficult to say without knowing the space and that type of thing, but I would be concerned about putting hot desks back into play certainly within the next couple of months.
Yeah, certainly for the game of massive jigsaw puzzle that I've been playing over the last few days, as we've started doing this exact same thing at Posturite, starting to try and make the site safe for bringing people back. We're reducing the number of desks, which inevitably means we've got less desks than there are potential people that are going to use them. So with your advice, Katharine, one of the things that we've been looking at is actually naming desks for up to 2 or 3 people, and then ensuring they are aware of that responsibility that they've got for the 2 or 3 other people that they might be sharing that desk with. And again, you can always go so far, can't you? And I think it's a balance, but I think we're getting there. But yeah, as I say,
maybe one could rotate the hot desks on different days of the week, so that you could have alternate desks. So, say for example, you're taking out of action half of your desks, so that you've got bigger gaps. You could take out of action different desks on different days of the week, perhaps, if you really want hot desking. Then you know that there's going to be a longer time period for any residual bugs to have died. But I'm pleased that the questioner here is, in any event, doing what's required, which is risk assessing, thinking about the issues, looking at the guidance, taking it into account, and maybe saying, you know, in my office, having taken everything into account, we're going to do this, but we can't do that. Put that in a written, documented risk assessment, and you're doing the right process.
Yeah, I agree.
Excellent. Well, I think that covers the majority of the curveballs that I was going to try and throw at you. So I think you've had an easy time today. So thanks very much. So Katharine, over to you.
Yeah, I think really, Simon, have you got any rounding off comments you'd like to make?
Well, I suppose the final thing is, it's up to everyone to try as hard as they can to keep up to date with the moving guidance and knowledge as it changes. We'll try and keep people up to date. I'm very pleased if people come to me with further questions. And I think the big thing to watch out for is really going to be important is this question of antibody testing when it comes in a bigger way, in a more available way, when it's available to commercial employers, and the issue of passporting and immunity. That's going to be the big topic, I think, in the coming months. It starts today with the government finally authorizing a particular antibody test. It's not a home test, but it's a particular test, and there are going to be more coming. And that's going to be the big space. Can you get the testing done? Can you look at people's results, and does that give you reassurance that they're immune? How does that play into who you let back to work, and whether you have a two-tier workforce? Very difficult questions. We'll probably come and do another session on that, perhaps.
Yep, I will certainly be contacting you, Simon. Be sure of that. Yes, I agree. I think keeping up to date is very important. We'll certainly try and make sure that we keep our website with the various links. But I think the government has produced those good documents, and as I've said before, the WHO and the European Centre for Control have put lots of documents out. And I also would suggest that we act gently and slowly, and the overriding message is, if you can work from home, continue to do so, and let's see gently how things, watch what goes on with people, watch how the infection spreads, and really just take things gently and react appropriately with the guidance we're given, and all work together and share resources. I think that's really what I just want to end off on today. So I just want to thank everybody for listening. We will be doing follow-ups when appropriate. Please keep your questions coming. If you can think of anything you'd like to know, let me know, and I'll see if I'll arrange a webinar. So really, Simon, thank you very much once again today for being with us and providing us some very valuable insights. And thank you, Chris, for being our question master. So
no worries. Thanks, guys.
I look forward to seeing everybody online in the near future.